Well, hi there. I'm Dr. LaBrasca. If you're watching this, it means you're getting ready for your tummy tuck, also known as abdominoplasty surgery. I want to take a few minutes to talk you through what to do before surgery, what to expect the day of surgery, and what to expect the first week or so after surgery. My goal here is to help you feel prepared, comfortable, and confident. Every patient's a little bit different, so always follow the specific instructions from my office. In this video, I'm going to cover the main things you need to know. Let's start with the time leading up to the surgery. In the days and weeks before your procedure, preparation's super duper important. For a smooth recovery usually starts before the surgery even happens. If you smoke or use nicotine in any form, it's very important that you tell me and stop exactly when you're told to stop, 4 weeks before and 4 weeks after. That includes cigarettes, vaping, nicotine gum, nicotine patches, anything similar. Nicotine is going to decrease the blood flow and it can increase the risk of healing problems after surgery. You should also review all your medications, vitamins, supplements, etc. with the office. Some medications and supplements can increase bleeding risk and may need to be stopped ahead of time. Only stop the medications if you have been specifically told to do so from my office or your PCP. In the week or two before surgery, focus on the basics. Stay hydrated. Eat well. Get enough protein, typically at least 100 grams a day, but more is better. Try to get enough rest. If you work out, keep at it. If you don't work out, just try to get like 10,000 steps in per day. It'll help your heart and lungs before surgery. Your body heals better when you go into surgery healthy and prepared as possible. You should also get your recovery space ready at home. Have a comfortable place set up where you can rest. Keep pillows, water, medications, snacks, chargers, anything else you need nearby. You're going to be sore and tight at first, so it helps to make things easy on yourself. You're also going to need a responsible adult to drive you home and stay with you after surgery. You can't go home alone. If you have young kids, pets, or a job that requires a lot of lifting or movement, plan ahead now. That'll make that first week or two much easier. Let's talk about the day before surgery. The day before surgery, go back over all of your instructions very carefully. Make sure you know what time to arrive, what meds to take, and what meds to not take, and when you need to stop eating and drinking. Don't eat or drink after the time you were given. It's super important for your safety. Shower as instructed. Don't wear lotions, creams, or anything else on your skin unless we told you it was okay. Don't wear jewelry. Wear loose, comfortable clothes that are easy to put on and take off. Something like a zip up or button up top is often best. And most importantly, try to relax. It's very normal to feel nervous the night before your surgery. That's completely understandable. The best thing you can do is be prepared and get a good night's sleep if you can do it. I promise I'll get a good night's sleep. Now let's talk about the day of your surgery. When you arrive, the team will get you checked in, help you get ready. We'll review your instructions with you again. I'll meet with you before surgery, answer any last minute questions, and make the appropriate markings and take pictures if I haven't already done that. After surgery, you'll spend some time in the recovery while the anesthesia wears off. You'll likely feel groggy, sore, tight, tired, etc. That's all totally normal. Most patients are going to describe the early feeling as tightness and pulling more than the sharp pain. Depending on the surgery, you may go home wearing some type of binder or compression garment, and you will definitely have drains if you had a tummy tuck. We'll show you exactly how to manage them. Before you leave, we'll review your medications, activity, drain care, and signs to watch out for. And if the plan is for you to spend the night in the hospital, if you had a mommy makeover, we'll take care of that too. Now let's talk about the first few days after surgery. The first 24 to 72 hours, they're definitely the hardest part. It doesn't mean something's wrong. It's simply the most uncomfortable part of the normal recovery process. You're going to feel tightness through your abdomen. You're not going to be able to stand fully upright at first. You may need to walk bent over for a little period of time, like a little old lady walking across the ice. This is expected. You should rest, but you should not stay in bed all day. It's very important to get up and walk around the house a couple of times a day. Gentle walking is going to help with circulation and it lowers the risk of complications. But you don't need to do a lot. Just short, light walks around the house are helpful. That's it, seriously. Take your pain medications and any other medications exactly as directed. Drink plenty of water. Eat light meals at first if needed and focus on getting that protein in there. It's also normal to have swelling, bruising, fatigue, and pain. Frankly, pain. Empty your drains, record the output exactly the way we instruct you to. That's going to help us decide when they're ready to come out. You can restart your GLP-1s the day after surgery. Don't inject into your abdomen. Inject into your thigh, your butt, or your arm. Hope that helps. Hello, you made it through your first couple days. Let's talk about the first week after surgery now. During that first week, most patients are going to start to feel a little better each day, but you should really still expect swelling, tightness, soreness, fatigue, and even pain. This is still early recovery. Your main job during this first week is to recover well. That means, please, it just means rest, walk regularly, stay hydrated, take your medication, wear your compression garment as instructed, and just don't overdo it, please. Even if you start feeling better, now is not the time to push yourself. Don't lift anything heavy. Don't exercise. Don't do housework. Don't do anything that puts strain on your core. Too much activity too early can increase swelling and slow your recovery. I want you to sleep in beach chair position after surgery. That means pillows behind your back, under your knees, etc. Some patients even prefer sleeping in a recliner for the first few days. Totally fine, no problem. Your follow-up visits are super important. At these appointments, we're going to check your healing, answer questions, and make sure everything is progressing the way we want it to. Now let's go over what's normal. A lot of patients are going to worry during that first week because recovery is not familiar. There are many things that are completely normal after a tummy tuck. These include swelling, bruising, tightness, numbness, fatigue, difficulty standing fully straight at first. It's normal for your abdomen to feel firm or swollen very early on. Your final result does not happen in the first couple of days. Healing takes time. Now let's talk about when to call me. Call me right away if you have fever, worsening redness, heavy bleeding, sudden significant swelling, severe pain that is not improving, shortness of breath, chest pain, calf pain, or anything that feels suddenly worse. If it's very bad, go to the ER. Don't even call me. If something doesn't seem right, you can call though. I'm always going to rather hear from you and help than have you sit at home worrying. Tummy tuck is a major procedure. Recovery takes patience, but if you follow your instructions carefully and give your body time to heal, you're going to be putting yourself in the best position for a smooth recovery. I'm here with you every step of the way. I appreciate you trusting me with your care. I look forward to seeing you on your surgery day. Let's go.